Now we will get closer to what it really is to be a physician, having a patient or a person, any person with symptoms from the lower urinary tract. We will go through differential diagnostics in the Lutz syndrome. The first thing you might think of is what many physicians also think of, is that there's some kind of obstructive cause here. We have the bladder and we have the urethra, and the urine has problems coming out. And in males, it's very often the prostate that is in the way. Usually a benign prostatic hyperplasia, an increased size of the prostate that could compress the urethra, causing problems with the micturition. These patients could also be patients with other obstructive disorders like a urethra stricture, which is a scar within the urethra. Or a prostate cancer could also compress the urethra and obstruct the outlet. All these differential diagnostics are obstructive disorders, and mainly they cause problems during the emptying phase of micturition. Then we have, as a physician, always in the back of our head, malignant causes on our list of differential diagnosis. We're always a little bit afraid, could it be a malignant disease behind this? And the symptoms from the lower urinary tract could be caused by a bladder cancer, malignancy within the bladder, or malignancy within the urethra cancer, very uncommon cancers, or prostate cancers. These three cancers can cause symptoms from the lower urinary tract. And you might think that these patients have problems with the emptying phase, like in prostate cancer and the urethra cancer. However, these patients can also have problems during the storage phase, because a cancer within the bladder can irritate the bladder so much, so symptoms like urgency and frequency are the main symptoms in these patients. Then we have patients with inflammation within the bladder. Patients with inflammation in the bladder could be patients with an infection, for example. An infection usually causes an inflammation, and that is irritative to the bladder. The irritation within the bladder wall causes urgency and frequency. We can also have inflammation within the bladder or the lower urinary tract due to an inflammation of the prostate, prostatitis, the urethra, urethritis, or the trigonum within the bladder, the trigonitis. These patients might have symptoms irritative from the bladder. That is urgency and frequency mainly. These patients therefore have mainly storage symptoms. And then we have totally another differential diagnostics to think of. We have to think of neurological causes here. The neurons and the brain and the control of the lower urinary tract is also involved in producing symptoms. These diagnoses could come from the brain, like for example Parkinson, could come from the lower part, the nerves closest to the bladder, like for example diabetes neuropathy, causing problems with the distal nerves, or it could be multiple sclerosis being in the nerves, or it could be disc herniation in the spinal tract. So we could have differential diagnosis on different levels of the nerve system. What kind of symptoms comes when you have a problem with the nerves to the urinary bladder? Well, this is really difficult, and you can, as a matter of fact, have any of the LUTS symptoms, depending on which level you have the etiology causing problems with the lower urinary tract. And then we have the differential diagnosis from other systems than the urinary tract. For example, we have the rectum very close to the lower urinary tract. Patients can have problems with the rectum causing symptoms from the lower urinary tract. Other parts of the body close to the lower urinary tract is the gynecological area, usually taken care of by gynecologists. Patients with problems from these areas can also have problems from the lower urinary tract. And then at some moment you also have to think that the psychogenic area can cause symptoms here. The psychogenic area could causing huge parts of the symptoms from the lower urinary tract, or micro little or nothing of the symptoms from the lower urinary tract. It's really easy to believe this because let me take a short example here. Think about your bladder for a little while. Just think of your bladder. And then, I mean, even if you went to the toilet just recently, you can really feel that, well, maybe I have to go to the toilet again. And if you start to think a lot about the bladder, then the bladder will start to take control over you. And you have to go to the toilet. You feel urgency and you get frequency secondary to the urgency. And that is the psychogenic part. And if you start to think a lot about the bladder, then the bladder will start to take control over you. And you have to go to the toilet. You feel urgency and you get frequency secondary to the urgency. And that is the psychogenic part. So we have lots of different causes that can produce symptoms from the lower urinary tract.